My favorite part of today's conference was just seeing everyone together and feeling the energy around continuing our education in osteopathic medicine.
I always leave having learned something new.
It's a great opportunity for us to have fellowship as osteopathic physicians.
I feel like my osteopathic tank is always refilled after these conferences.
The Statewide Osteopathic Collaborative is a network of 5 programs across the state of Wisconsin that have a passion for improving their osteopathic education for their residents locally and also statewide.
So quarterly throughout the academic year, we have about a 6 to 7 hour conference where we have hands-on, case-based, evidence-based, relevant training in osteopathic medicine and manipulation. So we have 12 rotating themes that go over a 3-year period.
This is a really safe and a very collaborative environment to explore new techniques, to relearn the old techniques.
Things that I learned today are skills that I'll be able to go out and use in all sorts of different clinical scenarios.
It also creates a sense of community and camaraderie.
We don't have to explain to each other what osteopathy is. We all just get it, which is really a nice place to be.
The faculty does a really good job of incorporating as much hands-on approaches as possible.
So it's really broken down to, we learned at a lecture the meaning and the intent of these techniques, and then it's followed up with the hands-on. So it's usually paired really well and balanced really well throughout the conference.
The different residents, based off where they did their training for medical school or how their faculty teach them in residency, they all have different approaches to osteopathic medicine, and I think getting some exposure to that is really helpful to kind of expand my mindset of how I can approach things too.
Whenever I had a question, I could turn to my left, turn to my right, look behind me, and there was faculty ready to help me out with anything that I needed.
One of the benefits of our conference is having these micro-learning sessions that happen where faculty are in a small group of about 4 residents speckled throughout the room, and they're kind of teaching their way to do a certain technique that might be slightly different than what the presenter's done.
Having those different exposures really helps me, and I think every other resident, best tune their own strengths and skills.
Wisconsin, despite not having a DO school, has multiple programs with osteopathic recognition. We value our DOs as DOs and want you to be a DO when you come here.
Osteopathic medicine is an art, and unfortunately I think about 20% of DOs actually practice OMT after they graduate medical school, and our postgraduate surveys from our residents that have graduated out of our collaborative show that our residents are doing osteopathic manipulation pretty consistently across the board, which is pretty incredible in the world of being a DO.
When I was applying for residencies, I knew that I still wanted to utilize my osteopathic skills, and being part of the statewide collaborative I thought would be a fantastic opportunity for me to continue honing in on my osteopathic techniques and being able to utilize them on a more regular basis.
I would recommend the Osteopathic Collaborative because looking back during my residency, I would feel that my growth in osteopathic skills would not be where it is without this conference.
This conference is so fun. It's just a space to get together with your friends and learn more OMT and practice what it is that you love.
And it is a great environment just to be our osteopathic selves.